WCCS AM 1160, 101.1 FM. He is Dr. Eric Bohn, and he's with us this morning. And let me tell you, I have to give full disclosure. Dr. Bohn is somebody who is very near and dear to my foot and my knee and everything else on me that's breaking down. Good morning.
Good morning. I'm honored to be near your body parts. I appreciate that very much. So
you should carry on a holster like an old West gunslinger. The cortisone.
A little 6 shots there. That's right. A 6-shooter.
Hey, serious stuff though we want to deal with this morning, away from my breaking down body, and that is there are so many things that you deal with in your practice, and maybe first of all, let's explain what it is that you do. Because you go all over the body.
I do.
Yeah.
I do. Yeah. So I think the best way to say that is I'm the guy that tries to keep you off the butcher block. Mm-hmm. With all due respect to my orthopedic surgeon friends, so I try to assess the body, whether it be from neck to toes, and basically try to find out what's going on, how I can fix it, and my thing always is why. Why does it happen? Mm-hmm. And I just don't try to fix the symptoms, but I try to find a cure, and I'm always trying to put myself out of business. Mm-hmm. But there's somehow people always wind up hurting themselves and coming back. So
there's the term sports medicine, but it's so much more than sports medicine. It's really the science of movement that you're dealing with.
Yes, sir. So it's basically if I were to I guess non-surgical orthopedic medicine. So it's movement, it's connection, it's soft tissue, mm-hmm. and me being certified in general medicine, family medicine too, kind of gives me, I think, that little bit more of an overall picture instead of, okay, let's look at the knee. Well, the knee's connected to, and that's the song that got me through med school. Knee bone's connected to the, so that got me all through. And truly, you have to kind of look at it as an integrated unit, and from there, hopefully we can come up with an answer.
One of the things that we might not associate with your brand of medicine and your brand of medical practice is concussions.
Yes.
But that's something that you'd have to deal with because it's everywhere, isn't
it? I think it's the awareness is definitely much more out there, and I think it's near and dear to my heart because I was a tackling dummy during my days. Someone mm-hmm. with a heartbeat, that guy, bring him in. And I probably had 4 or 5, maybe even 6 concussions. I am fine now. Just disclaimer, my brain is working perfectly fine. But so that is one of those things where it's not only high school kids, it's on the job, it's people that may have there's a lot of falls recently, and or down the stairs, the ice. So it's one of those things where we're learning that it's so much more than just I have a headache, I'm tired, those kind of things, where I feel a little foggy. I mean, it can affect eyes, it can affect your balance, so many different things.
And so many different ways in which it can be treated. And really narrowing down exactly the right approach has to be a part of that whole puzzle for you.
Yes. Puzzles, again, it goes back to the why thing. People present with a group of symptoms, and from there, and also through the physical exam, you determine where the noise is coming from, where the smoke's coming from, and once you find the fire, that will kind of guide the treatment. Mm-hmm.
So people might not even realize that what they're dealing with, whether it be blurred vision or a general fatigue or something, might be related to having suffered some sort of blow on the head, or maybe not even a blow on the head, but just a sudden jerking motion that could make that brain swim around a little bit.
Absolutely. And I've had people that, my son just never had an interest in reading, or never had, and you found out that through picking through the history, they may have had an injury years ago, and there's these symptoms that have been smoldering for years, and we've had great success through Jamie Cheehey, who is our vestibular and ocular motor specialist, that we can get these kids back, we can get these people back. I have a patient now who's in his 30s, and he was injured when he was 19, and we're now finally making some headway, and he's been living this way for almost 20 years. Yeah. And of course, comes along with that depression, anxiety, self-worth. I'm dumb. I can't read. I'm no good. And I'm actually seeing, you're dealing with the soul that is the person as well. And we're seeing him turn around not only spiritually, mentally. It's really it's very satisfying.
Yeah, that journey, that exploration that you get to do. I'm going to put it that way, that you get to do.
Yes, sir.
In order to help someone return to a life that is more like the life that they want to be leading.
Absolutely.
All right, let's get to the science of movement in terms of walking and running and those sorts of things, because there are going to be people getting out now that the weather is finally going to start to change for us. They're going to be wanting to pick up their outdoor exercise routines. Even walking can be a challenge if you haven't been doing it for 3 or 4 months. You can.
Are you speaking from experience, sir?
No, I've been on the treadmill all winter long. It's just yesterday I did my first road work of the year. It's like, holy cats!
Yes.
What happened? Why is it so different?
Yes.
Why is it so different?
Well, I mean, when you deal with a treadmill, it's a very stationary, very uniform movement. Mm-hmm. Obviously, you can basically adjust the incline, but that's pretty much it. And then when you're out and about, there are so many different road surfaces. There's so many cambers of the street, depending on where you live. Obviously, gophers like to have fun, and so there's always these little shotskis around the yard and such. So oftentimes your body likes uniformity, so it'll get used to a certain movement. And that's the reason why it's so important to either cross train, or if you're in the gym, do different body parts, just to change things up and keep things. I don't like to use the term muscle confusion, because our muscles don't get confused. We get confused. Muscles just do their job. So oftentimes when you subject yourself to different environments or different surfaces, it wakes up certain parts, and you go, "Oh, I didn't realize that's kind of interesting." So whether it be your plantar, whether it be your heels, whether it be your calves, or some of the ankle stabilizing muscles, all of a sudden you start waking things up that maybe you haven't used. You've used another set of muscles, and all of a sudden these stabilizer muscles have to work a little harder. And people go, "Oh," and they come to me and say, "I didn't realize that." And you wind up they have maybe poor mechanics, maybe their ankles are inherently weak, and so we try to find those things, try to correct them, because the last thing I want someone to do is stop doing what they're doing. Oftentimes people come to me, "Well, someone said just, Doc, it hurts when I do this." Well, don't do that. Well, I mean, that's not good enough to me. How can I keep you going? How can I keep you moving? And do that in a way that is hopefully the best for the patient.
Here's an example. A couple years ago, you helped me discover this. I was having hip pain during my runs, and we figured it out between the two of us that the road that I start out my run on is my right leg, as I run down the hill, is hitting at a different height because of the surface of the road than my left leg was, and that was the cause of the pain. And just that little journey of exploration. One of the big things that I know that you like to do is watch someone walk as they walk away from you, to see how's their foot falling. What are they doing as they walk? That's a pretty important thing.
Well, that's the thing. It's you most people, you see them on an exam table. That simply is not good enough for me. So I need to talk to my superiors if I can get a catwalk. I think that'd be pretty cool, and maybe some lights, that kind of stuff here. Spring fashion show. But having them walk is one of the most important things. Knowing this is what they do, this is what they enjoy doing. You can actually see a lot of deficiencies, whether it be the way they can't turn their hips, the way the ankles move. So you can. Really, that's a great diagnostic tool to look at, and that's I was blessed to have that as one of my tools to help.
Just looking at the bottom of their sneakers helps you too, doesn't it?
It sure does. It sure does. It's kind of like a crime scene. There's fingerprints all over the place, because that's what you do, and that's you can tell if people if they turn their feet in, if they strike laterally on the outside of their foot, if they have a higher arch or banana feet, we call them. So from there, that can give you diagnostic clues and help you to correct and make the make the right diagnosis.
So when you find things that people are doing that is causing them pain, that is hurting them as they walk, or as maybe they're runners, there are a number of different approaches to treating that. You have medicines at your disposal. You have different orthotics that someone might use. One of the things that I find that is most important is you can't go to Dr. Bohn once and say, "Okay, fix this," and walk out of the office 20 or 25 minutes later and everything's fixed. It becomes a process, doesn't it? Not just in terms of visiting you, but in terms of making those changes in your lifestyle, because you've built habits, and habits are things that you do habitually.
Yeah, exactly, absolutely, and they're hard to break.
Yeah.
The good ones are hard to have, and the bad ones always seem to be really easy to hold on to. And I think one of the first things is really evaluate your sneakers, because oftentimes people hold on to a pair that they may have had for a year, maybe 2 years, and oftentimes it just may be a change in the proper sneaker, or having the sneakers. It's not just, I like the pink ones, I like the blue ones. Each sneaker is built for a certain foot type. So to have someone who is knowledgeable, not just, I'm not going to mention any store names, but not some pimply faced, 17-year-old. So you wanted the 9.5, and sorry if anybody has pimples, but it's also, it's looking at that foot, because they have different shoes called lasts, and that is the form or the function of the original shoe. So shoes are made kind of like tools. To me, I look at them as, well, do I want the ball peen hammer? Do I want, the needle nose pliers? And just picking the right tool oftentimes can help you tremendously. So all shoes are probably good for about 200 miles, 300 miles so depending on how often, that could be 3 months, that could be 6 months, and it can become, it's a very low tech activity. However, it can be expensive if you want to do it correctly.
Yeah. Just get New Balance shoes and you're fine.
Yeah, there you go. Amen. New Balance. We get paid for that? Okay, I don't know if there's a sponsorship.
They're not around here anyway, so
no,
we
okay.
can go ahead and say New Balance shoes. Those are the ones you need to get.
New Balance.
Okay, so folks want to learn more about what you can do for them to help alleviate their pain, whether it's knees, shoulders, feet, hands, whatever it happens to be, anything that moves. You could probably help them out.
If I will do the very best I can. And I'm also never proud enough to say I'm not really sure, and then use our other physicians, whether it be our physiatrist. Sometimes it's an innate autoimmune disorder that presents as joint pain, and so we have Dr. Mankey, rheumatologist, here too. So I'm very blessed within our office. We have, it's almost like it's a Walmart of sorts. We have a little bit of this, a little bit of that. We don't change oil yet, but I think that's on the docket. So I think we're getting there.
It's about that time.
Yes, sir.
All right. Thanks for being with us. What do people need to do in order to avail themselves of your services?
Yes. So you can give us a call. The number is 888-452-IRMC. Again, that number, and pull over if you're writing this down, 888-452-IRMC, or you can look us up online at IRMC Docs, that's DOCS.org.
Very good, Doc. Thanks for being with us this morning.
Thank you.
We appreciate that so very much. I feel better already. It is the voice of Indiana County, WCCS AM 1160 and 101.1 FM.